안녕하십니까. 온라인 서전의 김경원입니다.
Greetings, I'm Dr. Kim Kyung-won of Online Surgery. Today we're going to look at surgical clip. Let's look at today's surgical patient. 62-year-old female patient. The patient first came in November 2021. In number 25, there was pain and bleeding, and there was also mobility. In the panoramic image, you can see the alveolar bone destruction. The chief complaint was that number 25, it was really hurting and there was bleeding and mobility was observed. As for PMH, although there is hypertension, it's under control. I'm going to show you the CT, but in number 25, alveolar bone was destroyed, especially in the palatal side. There was a wall defect on CT. Because the patient was in pain, we decided to extract number 25 and socket preservation was done. A Oss and Ossguide were used to do socket preservation. In number 25, the plan was to place the implant using one guide. On CT in number 25, you can see how the alveolar bone is destroyed, especially in the palatal region. In this case, socket preservation is done. A Oss collagen and A Oss are being compared. In this case, we used A Oss for socket preservation. In the palatal side, the wall is completely destroyed. Upon surgery in the palatal side, there's slight inflammation. You cannot really see it here, but when I removed all granulation tissue here, there was absolutely no palatal wall. A Oss graft was done. Ossguide was used to cover the site as suture was done. If you look at the extracted tooth, on the buccal side, there's slight blood, but on the palatal side of the tooth, there's just plaque. In the palatal side, there was no alveolar bone and there was no wall at all. Socket preservation was done, and this is panoramic x-ray right after. In the area where there was bone defect, you can see the A Oss has been grafted. On CT, you can see that in the area where there was palatal defect, the A Oss has been grafted and socket preservation has been done. This is panoramic x-ray after 4 months. On the panoramic image, you can see that there has been no major change since socket preservation. CT was taken 4 months after. If you look over here, it's being maintained, but more so than thought, there's a bit of resorption here. This is 4 months after. If I were to do it again, I would have used A Oss collagen because it would have been more favorable for space maintenance. Because of the palatal mucosa was thick, a bit of a collapse occurred. In order to use one guide, the Implant Studio was used to come up with surgical plans. KS3BA 4.5 by 8.5 millimeter implant was planned. Fortunately, in the palatal side, there was no penetration up to the sinus, so one cast was unnecessary. I believe that implant fixation can be gained by engaging the sinus floor. That was the surgical plan. I believe the surgery can be possible by slightly engaging sinus floor. This is immediate post-op. If you look at number 25, it has been placed nicely using one guide. It's been about 5 months since socket preservation. KS3BA surface of 4.5 by 8.5 millimeter implant was placed. Primary stability was over 36 Newton centimeter, and ISQ was 75 and 75. Surgery was completed after connecting healing abutment. If you look over here, this is right after implant placement. This is the CT image. The implant has been placed slightly deeply. There was slight bone loss on the palatal side, but the implant is within bone housing. During surgery, biopsy was done where A Oss socket preservation was done. Around the graft material, new bone is being formed. I wanted to look at what differences existed between A Oss and A Oss collagen using biopsy and after surgery. It's been about 1 year and 2 months since socket preservation, and this is ER-type prosthesis. It is being nicely maintained. This is CT image after 1 year and 2 months. In the CT image, you can see that the palatal bone is being well maintained and healing has been done nicely. Let's look at the surgical clip.
수술 동영상을 통해서 만나 뵙도록 하겠습니다.
Ossguide template is adapted to check whether it fits properly. Distal side is checked, and you can see it has been nicely adapted. Tissue punch is used to remove overriding mucosa. This does not have a stopper, so you can do it sufficiently deeply to remove the mucosa. Template is removed. I'm checking whether tissue has been properly removed. Template is being positioned once again. Because I'm going to place implant slightly deeply, I'm going to flatten the bone structure because I'm going to place the implant deeply. As shown in the biopsy, a thin trapline drill was used to biopsy where socket preservation was done using A Oss graft. Initial drilling is being done. Up until contact, sufficient drilling is done. 3.5 by 8.5 Ossguide drill is used for drilling. I did not think that sinus floor is going to be fully penetrated, therefore instead of one cast drill, 3.5 by 8.5 Ossguide drill is used. Depth gauge is used to check whether it has been penetrated fully. For final drill, 4.0 by 8.5 is used. Although I'm going to place 4.5 diameter implant because this is a socket preservation site, I'm going to do under drilling. So 4mm diameter final drill. KS3 BA surface, the 4.5 by 8.5mm implant is placed. Because it is BA surface, the saline is used to irrigate it sufficiently. The implant is placed about 80% using engine. Primary stability is rather favorable and primary stability is over 30 Newton centimeters. It looks sufficiently stable. You can see that implant has been nicely placed. A smart peg is used to measure ISQ value. ISQ value has been measured. 75. So it's rather stable. Healing abutment is now being connected. Healing abutment has been connected. Surgery was fairly simple. Socket preservation using A Oss was done previously, and on the palatal side, if you look at the CT before surgery, there's a bit of resorption, but actually implant has been placed deeply, so there were no major issues. Thank you for watching.
그대로 수술이 진행됐던 케이스라고 말씀드릴 수 있겠습니다. 시청해 주셔서 감사합니다.